Jai Hind friends, I'm Dr. Sujata Baheti, Professor and in charge of the Tobacco Association. So I'll take this wonderful opportunity to tell about the World Tobacco Day that is celebrated on 31st of May every year. So this year's theme for 2025 is Unmasking the Appeal, Exposing the Industry Tactics on the Tobacco and the Nicotine Products. This year's World Tobacco Day campaign aims to reveal the strategies employed by the tobacco and the nicotine industries to make their harmful products enticing, particularly for the younger people. By exposing these tactics, World Health Organization seeks to drive an awareness, advocate for the stronger policies, including a ban on the flavors that make the tobacco and the nicotine products more appealing and protecting public health. Tobacco use, a human-created epidemic, kills 1/3 to 1/2 of all the people who use it across the world. Nicotine, the principal constituent of the tobacco, is highly addictive. Recent survey in India has reported that 83% of the tobacco users wanted to quit, of whom 51% was unsuccessful. This commonly arises from the lack of trained health professionals to support the quitting. Whereas we see that in India as being the 7th largest and first highly populated country, comprising of 1.46 billion individuals in it, the beauty of our country is that we have the highest number of youths in the world, that is 356 million youngsters are between 10 to 24 years, which contributes more than 50% of its total population. They are the reason for the education, growth, development and the future of our country. But unfortunately, many of them are getting habituated to one or the other form of the tobacco products. Currently, we get to see that nearly 137 million people are using the smoking form of the tobacco products, which makes India second highest consumers of these smoking form of the tobacco. So we have to take a lot of precautions in making these patients to get rid of the habit, and that is where the initiative starts because this is the one which is leading them to develop various forms of the potentially malignant disorders and the oral cancers. With this initiative, we are going to come up with a lot of health-related programs in the future. Thank you.
Hello everyone. This is Dr. Sheetal Saniko, Professor, Department of Parodontology at the Maratha Mandal's Nataji Raoji Halgekar Institute of Dental Sciences and Research Center, Belgavi. Well, I am here to create awareness regarding tobacco use and its harmful effects, and how to go about decreasing the habit or go for tobacco cessation. Well, tobacco cessation in dentistry refers to the role of dental professionals in helping the patients to quit use of tobacco products. Since the use of tobacco has a direct and severe effects on oral health, dental setups or institutions have strategic points or strategies efforts in support of the cessation efforts. Well, now, what we should have a tobacco cessation is important because tobacco use, may be smoking or smokeless tobacco, has a tremendous effects on oral health as far as it causes oral cancer, it causes periodontal or gum diseases, it causes tooth discoloration, halitosis or bad breath, it has delayed wound healing after dental procedures, and also it causes implant failure. Well, dental professionals can incorporate the 5 A's in the model. Those 5 A's are: we ask the patient the history of smoking and record it at the visit. Advise the patient strongly. We urge the tobacco users by telling them the strong effects of tobacco on oral health. And next is assess. We assess the determination of the patients to quit the tobacco habit and then assess them. We help them to also set a quit date and also help them every visit when they come by counseling. And lastly but not the least, we arrange a follow-up. Well, and also arrange for nicotine replacement therapies like chewing gums, patches, and recommend many other drugs for their health. And for those who are not ready to quit the tobacco habit, there are 5 R's. That is relevance, risk, rewards, roadblocks, and reputation to help them motivate So, motivational interviews, techniques to enhance the readiness to quit. So these are all the different procedures what we do in our institution where we have a tobacco cessation cell. So we urge the patient to come to our institute to render the tobacco cessation habit completely quitting, and also every 6 months, whether you have a habit or not, please to visit a dental clinic or a hospital. Thank you so much.
Jai Hind. Myself, Dr. Prachi Katti from Department of Oral Medicine and Radiology at Maratha Mandal Nataji Raoji Halgekar Institution of Dental Sciences, Belgavi. This World No Tobacco Day, let's send a message that echoes worldwide. Youth are not for sale, our future will not be shaped by addiction. Let's unite as a parent, as a teacher, as a doctor and a decision maker to create a world where children and youth grow up free from the grip of tobacco. Thank you.